I record in two different places just in case, and that's a habit, so it's more of
Sure.
a double whammy recording. So if something goes wrong on the other end, so then I don't have any issues. And by the way, good morning. I didn't say good morning to you, so sorry about that.
Good morning.
Hi folks, my name is Girish, the host for Back to Basics, another Back to Basics for another week. Today we're going to talk to you about healthcare in technology world, of how has changed over the years, all the way down from 1990s till today's date, of how things have progressed or digressed. We'll figure that out when we get into the episode today. But I have this person I've talked to many times on LinkedIn and some other places on phone calls, and she's an awesome lady. So we're going to go and invite her into this call today, and her name is Stacy. Stacy, how are you? And thanks for coming to Back to Basics.
Good morning. Thank you so much for having me.
Absolutely.
How are you today?
Very good. Totally awesome. Thank you so much. So before
Good.
we get into the basics of the healthcare and how healthcare has changed our lives in many different ways, what does Back to Basic mean to you?
Yeah, so back to basics, I kind of think of it. So I'll give you two different ways here. So if I'm thinking about it with my nursing cap on, then what we, always like to say when I was an ICU nurse is always go back to the basics when something's going wrong with your patient. And so for that in nursing, that means going back to what we call the ABCs, airway, breathing, and circulation. So, we always want to check and make sure our patient's airway is good, that they're breathing okay, and that their blood is, circulating, their heart's pumping.
Of course.
So, it's especially good for like nursing students or newer nurses. Technology is great, but sometimes it doesn't always speak the truth. And so sometimes when, our patients' alarms are going off, maybe there is nothing wrong with them. Maybe a wire just got crossed or disconnected. So it's always important to go back and actually check the patient and kind of take it back to those basics to check.
Yeah.
And then the other answer I would give you, just in personal life, not related to nursing, but, for me, just remembering kind of, whenever you're maybe going through a struggle or a transitional period in life, sometimes it's easiest just to take things back to the basics. And, if you're having to make a really big decision in life, take it back to the simple things like, making a simple pros and cons list of your different options. And then, considering which one either has the most pros or the cons are the lesser of two evils.
Of course, of course. Yeah. Thank you again, Stacy, for answering that question in the business world, in your world, which is the healthcare, and then your personal aspect of Back to Basics and what it means to you. So thank you again for that.
Sure.
And again, welcome to Back to Basics. We're going to talk about healthcare, aren't we? And we're going to be talking about in the technology world of how it's kind of changed over the years. I mean, in my introduction, I did say 1990s, but obviously over the 90s, 70s, and all the way till today's date, a lot of things have changed.
Absolutely.
It could be a disadvantage and advantage in many different ways, and we're going to get into that also. So, from your thought process, what are the new methods that you feel that it was a big advantage to you?
Sure. So I think probably one of the biggest advantages and changes has really been kind of that the technology piece of adding what some people call the EMR, electronic medical record, and some people call the EHR, electronic health record. Both the same thing, but really just kind of moving from the very old-fashioned hand charting method to getting it in an electronic record. And it was funny because, not to date myself too much, but way back in the day when I was an ICU nurse, we actually had the 4-page, fold up like an accordion, and you pull it out and it's 4 pages of paper, flow sheets that we charted on. And, those 4 pages were a 12-hour view of your patient's life.
Right.
And I remember when we were transitioning to the electronic medical record, of course, anytime there's change, you're kind of weary at first. One of the biggest worries was that, I can quickly grab this, open up this 4 pages and see, all my vitals, all of my fluids that have gone in and out of my patient, assessments and notes. And it was quick, easy access. And so the worry was, well, when we go to this computer charting, now we have all these different screens we have to go to and click on this and click on that to view things. But I can say that, as we, of course, learned how to use it appropriately, got used to the charting, got used to all the clicks and where does this and that go, it obviously became a much, easier method of viewing the patient. And it made just simple, basic things easier, such as, when I'm a nurse and I go to chart on my patient, I had to find the physical chart to write on those flow sheets. And, sometimes the doctor had grabbed it, or the respiratory therapist or physical therapist, so you're hunting all over just to find a chart to make some notes, which is kind of aggravating. And then also, if the nurse and the doctor need to be in the chart at the same time, obviously when it was a physical chart, that was much harder to do. So the electronic medical record made it much easier because, I can go to any computer in the hospital, pull up my patient, look and see what's going on with them. Doctors can look at it, the consults. So if, you're having a cardiology consult or urology consult, they can take a look and see the patient and how things are going in the ICU before they actually get to the unit to physically come see the patient. So I would think, that was something that was a huge change, and really a positive one once we kind of got used to it and learned the system.
Of course. I mean, in the beginning, I'm pretty sure, you can be honest here, I'm pretty sure you must have said that, oh, this is a change and I don't like it.
Oh, absolutely.
But honestly, if you really look at it in a positive way, that yes, this change is a good change, and that it's more of a skill and training in your head of how to go back to basics on that you can see all different tabs and links all in that one chart just for that patient. Am I right?
Absolutely.
Yeah.
And our fear of not being able to see that 12-hour span quickly, it was funny because the opposite became true, because then of course when it was on the computer, you could see a 7-day span, quick and easy.
That's right.
In the computer, so it actually made it much better.
Yeah. Thank you again. And I'm pretty sure it must be a training aspect of too, to learn, because it's a new technology, it's a new way of thinking, a new wave of thinking. I remember back in the days when I was in my technology world. I'm still in the technology world, but in the healthcare aspect of it, that there used to be talks about how HIPAA is not going to go and allow this whole technology base, because it is a new aspect of it, right? And you're bringing your paper, your blue and your pink slip into the technology and scan version of it. I think there was a whole struggle and a whole fiasco when HIPAA was talking about this whole thing. But then I think now they're being more lenient and understanding that we're trying to save the world from the saving the trees too at the same time, and getting all the different aspects. So it's not all about healthcare. It's also all the environment that we're trying to save here. Am I right or wrong in that?
Absolutely. No, absolutely. It made a huge impact on, how much we were printing and, how just the flow sheets in general, 4 pages, together. And of course that was the much thicker paper, and, so a lot more environmental waste,
Yes.
that was happening, that now we're kind of saving that aspect. So that definitely made a huge difference. And even just, in ICU, sometimes you're doing vitals on a patient as much as 5, 10, 15 minutes, every 5, 10, 15 minutes. So even as simple as now we don't have to print out all those vitals to then go handwrite them in a
That's
chart.
right.
They're flowing into that electronic medical record. So just small, simple steps like that really did make an impact. And I would say another area, in regards to HIPAA, that this really did kind of help is transition of care.
Of course.
So, when we move the patient from ICU and they've graduated and get to move out to a regular medical floor, or even if they're going from the hospital, to a skilled nursing facility or rehab place, the electronic medical record really helped with things such as med reconciliations. So making sure that, we've now taken them off the medications that they were on ICU, and now they're going out to the floor. And so they don't, they don't need that sedation. They don't need that blood pressure drip. So getting those removed, and then making sure that the next area that they're going to knows exactly what medications they're on when they had the last one, when their next one is due. So that is something that I think the electronic medical record has greatly assisted with. And especially when you look at patient populations like our elderly patients who, maybe they have Alzheimer's or dementia. So maybe they can't remember exactly which medications they're on, or they thought they had their medicine an hour ago, but it's really been 6 hours ago. So that's something else that I think has been a very positive impact that maybe people didn't even necessarily think of when it was coming out.
Yes.
But now we're recognizing the benefits.
Yes. Thank you again. There was an episode on some TV show that I saw in a hospital thing, and they're all electronic, right? Now I'm going to go to the disadvantaged side, okay?
Yes.
Just for a second,
Okay.
not too much of it, okay?
Sure.
So that episode actually, there was a virus into the system, meaning into their database. So which means that they got hijacked, right? So which means that I don't know if Stacy needed 2 pills or 3 pills or even 1 pill because she came out of it, or she added more. Those are the aspects of it, right? So how do I know what Stacy was taking? And there was a different aspect that when they go to a psychologist and psychologist is giving them a pill, okay, they didn't even know what type of pill that he or she was taking. Found out later that he was kind of overdosed. That's a separate topic. That's a TV show. But here's a scenario that if something does happen, a power failure, a virus hijack, or whatever, what are your thoughts on that? Is there a backup plan on that?
Yeah, so that's something that we really had to work hard on and focus on when this, the electronic medical record first came out. And depending on the type of system that you use, the one that I'm familiar with is Epic, and what they do is they have something called downtime computers. So they have computers that have the patient's basic information and most up-to-date information before, let's say, the power outage happens. So you can go and you can pull that information up and print off what the latest, information is. So you at least can see, what meds were they given earlier today, and kind of where am I for going forward. And then of course, when that happens, we all have to then resort back to charting by hand, and kind of pulling out those old methods, and being able to chart by hand on paper until, your power's back up or whatever the case may be that took you offline. And then of course it causes extra work because once you're back online, then we have to take the time to go back and take everything we've handwritten and get it back into the computer. But it at least gives you a way to kind of keep moving forward, while you have that glitch, because certainly, especially in your critical care areas, if you're not in the hospital in critical care, it's not as detrimental if the power goes out for a little bit.
Of course.
But in critical care where it's literally life and death, and you're adjusting things every 15 minutes based on vitals and things like that, you really can't afford to be down,
right.
And the computer system go down and not know what meds are on and what's coming up and things like that. So they definitely had to work very hard to kind of have that fail-safe method, where you can print up to what last happened. Now, of course, there's always still room for error in that, right? Because if a nurse, gave something and maybe hasn't charted it yet,
That's right.
or something like that, there's certainly still that small window for error that, you really have to be careful and think about.
Yeah, so I mean, we keep on learning, right? I mean, these are the aspects and these are the things that I actually thought when I was watching this show that, you know what, I need to bring someone in to understand the logistics of how a trauma situation comes in that you have no power. Power is easy to
Right.
fix because you have a generator. But when it
Right.
comes to viruses and database hijack and all, it's a
Hmm.
little tough to do that. And
Absolutely.
I'm pretty sure you're not an expert in that aspect. But I do want her to understand from a person who's on the field. When I say field, I mean in the ER section and the healthcare floor, to understand from your point of view as how do you do it, and you explained it well. So thank you again for that.
Sure.
So regarding smart, let's say, pacemakers and extra IoT devices that we give clients. When I say clients, I mean patients. How do we keep track of that? I mean, is that a, a new way of keeping track of how he or she is doing?
Oh yeah. So, I definitely think that is another huge thing that's come along as kind of the ability for telehealth, and being able to monitor patients remotely. There's so many things that we can do now, where you can have kind of those virtual visits. Doctor patient can be doing what you and I are doing over the computer, and thankfully, because of these different machines, we can take their vital signs long distance. We can look at their heart rate and how it's doing, especially with the pacemaker abilities. Nowadays, even kind of the functionality of like smartwatches, where you can take your O2 sat, and certainly, obviously, depending on the type of watch or device that you're using, obviously the quality of it, there's different aspects that go into it, but most of them, are relatively pretty close within measurements of each other, where you can at least get a pretty decent picture of a patient. And that's something that's been huge, and especially in periods where, for example, our wonderful pandemic of COVID, at the height of it, when our hospitals were getting full, the telehealth visits really helped with being able to open up beds
Mm,
and, maybe send some patients home who normally you would have kept for another day or two in the hospital to be able to monitor their vitals and different things. But now, thanks to telehealth, we can send them home, but still have the security of being able to monitor them, make sure that nothing's going wrong with them, so to speak, that we certainly couldn't have done,
of course,
10,
of
15
course.
years ago.
You know, Stacy, with the times that we're living in now, and you bring up a good point that we're not supposed to go to the hospitals much because you might get affected by this COVID and virus and everything else, right? And be cautious about it, the mask and everything else, right? And
Hmm.
elderlies who cannot go to the hospital, forget the COVID, but travel time
Right.
also, right? So
Absolutely.
these IoT devices do help in many different ways. You know, the pacemaker, the heart rate and blood pressure and all the X, Y's, and Z's that we can think of, right? Do you
Absolutely.
think we are going overboard when it comes to these things? Or do you think that this is the right time to be in this place? What are your thoughts on that?
So I think there's a lot of challenges right now in healthcare. And I think one of them, just basics, is staffing.
Hmm.
And so, we're starting to see staffing shortages across the nation, in every area, not just nursing, but, doctors, respiratory therapists, physical therapists, our nursing assistants, which we certainly couldn't do our jobs without. So we're starting to see, shortages. And we're also starting to see, as our world is growing and spreading out, there's plenty of areas that don't have much access to healthcare.
Hmm.
So our more rural areas, and maybe they don't have, a hospital close by, or
Sure.
there aren't that many physician offices close by. So I think, in that regard, the technology and using this is becoming of extreme importance, and especially in this time,
Hmm.
where we're starting to have shortages,
Hmm.
because it's definitely important for people to still get the care they need.
Hmm.
And with the pandemic, a lot of people were afraid to go to the hospital,
Hmm.
or even out in public. I mean, I know plenty of people who didn't leave their house for a while, and except to maybe grab groceries or
Sure.
something. So, it's you don't want to lose touch with your healthcare providers. You don't want to miss those health maintenance things that you need, because once you start missing those appointments and start taking care of the preventative side of medicine, that's when you start to see kind of health declines, in patients who maybe feel bad and normally would have gone to the hospital or doctor, but they're kind of waiting because they're scared. And then their condition worsens. And, then we have a harder time, getting them back to that healthy status. So, I think in these cases that it's a really good thing to be able to have and to do.
Of course.
Yeah, so I would say probably it's more beneficial, and especially during the timing of today and kind of what's going on in healthcare, that this really is the right time to introduce it. But it's funny that you asked, because also, last year really was when a lot of places started focusing on virtual visits, and let's move that patient to a virtual visit instead of having them come in. And in the beginning, even patients are a little weary, because it's kind of hard to even think about, how can my doctor really examine me if I'm not in the room with them.
That's
right. And so it's kind of, it takes a minute to really get used to that and think about the different technology that we can use. And certainly there's always going to be things that you just can't do virtually, that you're going to have to come in and
Absolutely,
and be seen
absolutely.
for.
Stacy, I mean, if you think about it, I mean, you and I are tech savvy people. We kind of understand how this whole virtual thing works and IoT devices work, and I don't know, the Fitbits and the smartwatches and all the pacemakers, the smart pacemakers. But there are people who still needs to learn, and they're still not tech savvy. So I think there's still struggles. But I think it's more of a shifting over and training themselves. Isn't that what it is?
Yes, definitely training them. And then, it certainly helps for the families that do have other people that can assist them. But, if you think about it, there's plenty of people, especially elderly people, that, maybe they don't have family. Like myself, I don't have children. So one day when I'm, older, it's going to be me and my husband, and then one of us, so, we may not have somebody else there to be able to help us. So, we kind of have to think about that. And, some of the time, we kind of joked, but,
Of course.
That in the beginning of the virtual care, the first 10 minutes of the visit was teaching people how to set up the, video and, kind of get the technology piece going. So that's something else that you definitely have to consider and, take into the equation when you're thinking about those types of visits.
Yeah, so I want to talk to my audience, if you don't mind, Stacy. So
Sure.
So there is a situation, there is an example, and Stacy can listen to this also. There is a person that I know who has blood pressure issues. Okay, now he has a total of, I don't know, 3-4 medicines. I have no clue. But what he did is he downloaded an app called, I don't know, blood pressure something, whatever it is. I can put that in the show notes and we can figure that out. But what he has done is he goes to the doctor, and he's totally anxiety attack person. So which means his blood pressure goes up, skyrocketing. Whatever the numbers are, because I did not ask him, that's something personal. But his numbers is high. So what he has done, and what his doctor has suggested, is to write it down on an app. And when he wrote down what his blood pressure is at home, could you imagine his numbers were normal? So which means that he's not needed an extra pill. The pill needs to be taken away.
Absolutely.
Or it needs to be adjusted, whatever the situation is. So it's always important to test at home, and that's what we're trying to say. Me and Stacy are trying to say that, you know what, you got to learn your technology in your home base. Yes, it is tough, but you know what, it's kind of needed, because you know what, me, myself, and they're three, I go to the hospital and I go to the doctor and I freak out, because I freak out if I get a needle in my hand. So it's the same process. If you do it at home, I'm pretty sure it's your home base, and you are more relaxed that way. That is just one example. There are many more examples to that, and that's what Stacy's saying. To help healthcare to be a better place, you should do an initiative to learn how to work your own for when it comes to technology, or get help. I would suggest to go and talk to your doctors. I'm pretty sure they will take an extra time to help you out of what needs to be looked at and what needs to be downloaded, and that's what it is. Stacy, what are your thoughts on that? Because there has been a friend of mine who's gone through this, and he did this at home, and his number came out fantastic, and now his numbers are a little off. So, what are your thoughts on these?
Yes, absolutely. What you described, they call it white coat syndrome. And,
Okay.
a lot of people have it. So just even seeing your doctor or nurse kind of causes a little of anxiety, even if you're there for a well visit. And so it's actually something that's very common in exactly what you just described. So, we've had patients that will send home that exact same scenario and have them check their pressures at home and then kind of report back on how they're doing.
Mm.
Sometimes in the doctor's office, if somebody can't do it at home, we'll put them on one of those automatic blood pressure cuffs
Mhm.
and just leave them, in the room and
Mm.
just, we're going to turn the lights off. You try and relax, and we leave for like 20 minutes and just let it take every 5 minutes.
Mm.
And you'll just see that trend completely go down.
Mm.
So it's something that's very real. And even looking at something like blood sugar levels.
Mm.
So diabetes is something that, of course, is very big and a very complicated
Mm.
disease. And it could be noticing trends. Like, it's important to take your blood sugar more than once a day. Now, of course, once you're regulated and you know what your blood sugars are and kind of how your body reacts, that's different. But kind of in the beginning stages of figuring it out, sometimes it's, my body produces more insulin in the morning or at night,
At night,
or
right.
vice versa, but there's a different time period where I'm getting a big dip. And so if you can kind of figure out when that time period's happening and when that dip's happening, then you can make adjustments to when you're taking your insulin, how much insulin you're taking, and really get more benefits from it.
Mm. Mm.
So being able to do those things at home and kind of look out for your own health and monitor your own health and symptoms is certainly good. And it helps your providers when you can bring that information back to them and say, well, this is what I'm seeing at home. And, this has been my blood pressure over the last 5 days. That can really help.
Yeah, yeah. Thank you again, Stacy, for making everyone understand that it's okay to test it at home, because these devices are you to train yourself and train the technology and give a history to the doctors, instead of meeting once a year or twice a year, depending on
Exactly.
your health and your wellness, as we do. So
Mhm.
yeah, thank you again. Now let's talk about a little about this alerts and this smart devices. What do I mean by that? Let me give you a scenario. Let's say I'm a patient and I need some drops into there's a bag in there, and it seems like my vital signs are a little off. Is there a trigger that it comes to you saying that, okay, I need to add more more drops than versus the ones that you did now? Does that make sense?
Sorry, drops of what? Or
Okay, so let's say insulin is dropped into
oh,
your
insulin.
okay.
Okay.
So let's say my vitals are totally off.
hmm
So does a trigger gets sent to you, and then that's how it happens, and that's where your smart device comes in and your IoT device comes in play, or how does that play on that part?
Sure, yes. So that it really kind of depends on what type of device the patient's on and what's being monitored.
Mm.
But if it's something where we're kind of doing like continuous monitoring and it's alerting real time, then yes, it's something that will immediately kind of alert the medical care team that's monitoring these things,
Mm.
and send a message to them so that then they can kind of look back and see kind of, well, what have the last trends have been? When did you give the medicine? What's going on? And then they can, call you or get in touch with you to kind of say, hey, you need to make these adjustments.
So if you do the same scenario, if you do it electronically, which means sitting at your desk and say, I'm going to add more, has that device been made yet? Or that's going to be in the works? What are your thoughts on that?
Yeah, I don't know. It'd be nice if it was out there, and maybe it is, and I'm not aware yet.
Okay, okay. Well, we'll go back to basics and safe to do this, or are we still learning the problems and the nicks on this part?
Sure. So I definitely would say that we're still learning, but I think they've certainly made it to where, as far as information being hacked into and things like that, certainly there's always going to be those computer hackers and things like that that trying to get in, and get the information. But as far as safety, and they certainly have as many safeguards as possible.
Of course.
Certainly hackers get smarter every year, right? So just when we think we're safe, they find another way in. But I think, as far as medicine goes, they're trying their best to use every bit of information that we have. Best practices is kind of what we call it. In getting as much information as you can about the patient, so that the doctor has all the information that they can get to be able to treat somebody remotely. But our information is also, or our ability to help is also only as good as the information that we get, right? So, if your patient isn't truthful with you, if they, hide some information from you, patients are also getting much wiser with technology as well, right? Because we can all Google things and find out, what's wrong with me, and what does this sign show? And certainly don't recommend that, because as we've all heard, you can Google yourself and it tells you you're dying when you're not. So
That's right.
you have to be able to decipher the information. But you do have this ability to look up information and kind of find out signs and symptoms for different things. And sometimes patients maybe withhold information or aren't as truthful, and so a doctor prescribes a medication not knowing that a patient is taking something else on the side, and maybe it interacts and causes a bad reaction. So there's definite things that there's truth in that saying, like, there's two people you should never lie to: your lawyer and your doctor. And there's a little bit of truth behind that. With the doctors, in healthcare, it's, I think, very important for people to know and realize, as a nurse, when you come in and see me and you're telling me about your medical history and what you do in your personal life. So, for example, things like, do you take drugs? Are you having sexual relations with anyone? I don't care who you're with and what you're doing. I don't care what drugs you're taking or not taking, other than, obviously, as a nurse, I want you to be healthy. But it's not a judgment place. It's a, I need to know what you're doing so that I know what meds I can or can't give you. And something just as simple, for example, can be embarrassing to men is, are you taking Viagra? Because a man comes in with chest pain, and if they've had Viagra at all that day, some of the common medicines that we use to treat chest pain, it can actually have a major adverse reaction with Viagra, and we could kill a patient.
Right.
So, and it's not anything that, you should be embarrassed about or worried about. And so I think it's hugely important for people to realize, when it comes to healthcare, your nurse and your doctor aren't sitting there judging you. I promise you, we've seen a million things worse than what you think you're doing. And so, just be honest and make sure you're given all that information, because it truly can make a huge difference in your healthcare and the outcomes of what we're doing to try to help you.
Yeah. Thank you again, Stacy, for that. One last question, if you don't mind. One last question. Sure. Is that the e-subscriptions that we have, we send it to the pharmacy. How convenient is that nowadays as before? Before, you used to write it down, meaning the doctors used to write it down saying, go to the pharmacy and get XYZ. Now we can just send it through electronically by the doctor to the pharmacy directly, and it saves a lot of time. So what are your thoughts on those aspects?
Yeah, so, I think it's made a huge difference for a lot of people. For medications, let's use the example of medications for ADD. So those, they usually only prescribe like 3 months at a time. And so parents of these children had to take time off work to go swing by the doctor's
Sure.
office to get a handwritten prescription to then take it to the pharmacy, so you're losing work hours,
Right.
which for some people isn't a huge deal, and for some people it's a very big
It's a big
deal.
deal, right.
You're talking about your paycheck being short. You're talking about your employer potentially getting mad that you every 3 months have to take off to go to the doctors. So I think in that aspect it definitely helped a lot of people. I also think that, you know, people were worried at first when we went to e-scribing that there would be more fake prescriptions,
Sure.
out there. And I think really what we found is the opposite has happened. Because of course to do the e-scribe, I mean, you have to, there's logon securities and credentials and information that you have to put in. So it would certainly have to be kind of like a hacking situation for somebody to get in. Whereas like with the prescription pads, I mean, there were plenty of times where people would, sneak and steal part of a pad or a couple pages off of a pad, in a doctor's office where they maybe saw one lying around. And, it's kind of like once you have the doctor's signature once, it was easier for people to fake. So I think it's really actually ended up kind of cutting down on things because it's coming, straight from the provider. It never gets in anyone's hands for
Right.
them to be able to alter it or copy it or, let me copy an extra one and give
Of
it to my
course.
friend. So it's going straight to the pharmacy. And I think it's actually been really beneficial.
Yeah, yeah. Thank you again. And sometimes, we think that it's a negative thing, but it's actually positive. And in this case, it became a positive thing. And if you really look at it, the doctor is directly talking to the pharmacist saying that this is what the patient needs. Or if a
Absolutely.
person needs to get some tests done, there's electronic sent to the other doctor for a
Mhm.
specialist to take a look at. So there are many, many different aspects of it. And I
Yeah.
think there's an advantage to it. So thank you again for that. So we have definitely found that there's some disadvantages and advantages when it comes to technology in the healthcare. But the more and more I speak with you and I'm understanding from you, it seems like it's more positive than negative, isn't it?
Yes, I would definitely say so. I think, we've really made some phenomenal advances that have really proven to be some of them even more beneficial than we thought they would be from the beginning.
Yeah, yeah, yeah. Thank you again, Stacy, for being on the show and making this brighter for me. Before you leave today, do you have any last words for Back to Basics, and how was your journey on Back to Basics so far?
No, so first of all, thank you so very much for having me. It's been a pleasure every single time we've spoken, and I look forward to our friendship continuing to grow and seeing each other on LinkedIn and following each other's comments and things, following your podcast. I think what you're doing is really important. I think it's great that you cover a whole variety of topics and really just getting back to the basics, and it helps spread awareness to people who maybe aren't familiar with that topic. And then is also a good reminder for those of us who maybe are familiar with the topic to really, occasionally it is important to go back to those basics and kind of remember, where you came from and where you're going and, think about everything in between. So it's something that I love, and I think you're doing great things.
Yeah, yeah. Thank you again, Stacy, for being here, and thank you again for all the kind words. And hopefully we'll talk more, and we will talk more. I know that, but stay blessed, and thank you again.
You too, and I hope you stay healthy and well. Thank you.
Thank you. So, guys, we spoke with Stacy today, and we talked about the basics of healthcare and the basics of technology, of how technology is changing our lives in many, many different ways. And as usual, as always, there's a quote of the day, and hopefully Stacy will like this quote. And here's a quote here. And the quote is, let's bring this up here. The quote is that we have the greatest hospital and doctors and medical technology in the world. We need to make them accessible to every American. Now, when we say American, I'm actually going to say everyone in the world, because that's what it is. We always have to make sure that we are living in a happy world, a healthy world, and we should be taking care of each other, taking care of yourself. That's the main goal. So guys, as usual, what do we always say at the end of the episode? everything in life goes back to basics, and that's what life is all about. And guys, take care, God bless, and comment as much as you can. Good, bad, ugly, either way, it'll make my show stronger day by day, week by week. And the three major things in this episode, or every episode that I do, it makes it a great hit, which is the content, the guest, and definitely the host. Guys, take care, God bless, and I will see you next week. Thank you. Next week's episode on Back to Basics.
Cut another piece. Because if you take a piece you have in your mouth, and then you're holding another piece of food on your fork, keeping it in front of your mouth like this, psychologically, you're pressuring yourself. So you rush yourself and you swallow much faster than you really need to. And once you feel that, you know something, I'm no longer enjoying the food as much, I don't care how much chicken's left on the plate. Stop eating. That's why I always say, eat the good parts first.
Of course.
And leave the worst parts at the end. Because you might not need to eat them.
Oh, right. And the fifth habit?
My favorite one?